everyone. My name is Dr. Erica Saylor, and welcome to the Life Unites Us April webinar, Data Sharing for Legislative Advocacy, Tailoring Your Visit. I'll start today by covering a few Zoom housekeeping items, then moving on to an overview of the Life Unites Us campaign, and then we will hear from Alfred DiRosa and his work with Prevention Point Pittsburgh, followed by Erica Saylor and her presentation on data sharing for legislative advocacy. After we've heard from our speakers, we will have time for questions and then wrap up for the day. So this is a reminder that if you have questions, please enter them into the Q&A feature and not the chat. If you happen to get disconnected from Zoom, please retry the original link. If for some reason you're unable to get back in, the meeting will be recorded and sent out later this week. Okay, moving on to learning a little bit about the Life Unites Us campaign. Life Unites Us is a project developed to reduce stigma around opioid use disorder. This is done by using a people-forward approach that aims to connect individuals through stories. Through research and practice in anti-stigma work, we have found that connecting people through their stories and similarities can and will reduce stigma. In order to do this, the team records stories of community members across Pennsylvania, stories of both personal recovery and as an ally to someone in recovery. Short stories are then produced and featured on the Life Unites Us website and social media. The intent is that by sharing stories of hope and resiliency, we can prove that recovery is probable, reducing stigma makes recovery more likely, addiction is treatable, those living with an addiction are just like everyone else, and those living with opioid use disorder are so much more than their disease. As I mentioned in the last slide, the campaign can be found online. The website features a library of resources that are shared across social media platforms. And the great news is that you can join us in ending stigma by following and sharing the campaign. If you are a part of a larger organization or effort, we would love to invite you to become a partner with Life Unites Us. If you are interested, please email Maddie Morales and we will make sure to drop her email in the chat box for easy access. Okay, so now that we've heard about the campaign, I also wanted to mention before I go into the speakers, that DDAP is currently accepting applications for 2 grant opportunities. The first is for recovery community organizations who will expand or enhance recovery support services to individuals in recovery from substance use disorder. Services may include the delivery of recovery coaching through certified recovery specialists, telephonic supports, education and employment supports, such as job coaching, resume writing, and engagement in GED services, and delivery of substance-free social activities. Up to 5 grants of up to $700,000 each will be awarded. Applications are due Monday, May 3rd by noon. The second grant is for entities with the capacity to deliver employment support services to individuals in recovery from substance use disorder seeking to enter the workforce. Employment support services under this project may include vocational assessments, resume writing, interviewing skills, job placement, and transportation assistance related to employment. Applicants should identify at least one employer partner that is committed to providing employment opportunities to individuals in recovery from substance use disorder. Up to 8 grants of up to $400,000 each will be awarded. Applications are due Monday, May 17th by noon. Application materials and a budget spreadsheet can be found under the funding tab at ddap.pa.gov. You can also find a Q&A section there. Okay, so now let's move on to the speaker and presentation section of the webinar. It's my pleasure to introduce our first speaker, Alfred DiRosa. Alfred is the PA Naloxone Project Coordinator at Prevention Point Pittsburgh. He started in harm reduction as an MAT counselor in Charlottesville, Virginia, before moving to Pittsburgh to pursue his MSW. Before joining Prevention Point, he spent 6 years managing the operations of Hazelwood Initiative in Pittsburgh, a nonprofit focused on community development and affordable housing. Since joining Prevention Point Pittsburgh last October, Alfred has been coordinating their online, mail-based naloxone program, which mails free naloxone to anyone in PA that requests it. Prevention Point hopes to use data from this program to inform advocacy for legalizing harm reduction services and mail-based supplies throughout PA. Alfred?
Thank you so much, and I'm really glad to be here and be able to share this work with you. Really happy to be a partner in the campaign. So I'll share my screen here. So I'll be going over an overview of the two organizations that are involved in this mailing program, and that's Prevention Point Pittsburgh and Next Distro. And then I'll be going over the details on the mailing program, how it works, who it serves, as well as the data that we are collecting through the program that we hope to use in advocacy or to inform advocacy, and then giving a bit of an overview about how this fits in with naloxone access generally in PA, how that kind of exposes needs for more harm reduction services, as well as expanded naloxone distribution. But yeah, I'll get started kind of introducing all to Prevention Point Pittsburgh. But first, just to take a step back about just recognizing the overdose crisis is still ongoing in the state, with Pennsylvania as well as the whole country, obviously. Pennsylvania has the third highest overdose rate in the country, after seeing a lull, like a decrease in 2018, started to increase again in 2019. Of course, the pandemic, the economic turndown, limited access to in-person services has caused increases in 2020, and those numbers are coming back now, and most of them are already higher in each across the state in respective counties, and it's expected to continue to do so. So all the more need for expanded and innovative ways of getting naloxone out there to people. But Prevention Point Pittsburgh is an example of a syringe service program, one of only two that functions in the state. There's a Prevention Point Philly, but we are not affiliated, but both able to operate thanks to county ordinances. So syringe service programs, Prevention Point was one that was founded in 1995, mostly through volunteers. And syringe exchange programs, while clean syringes, sterile syringes are like the bread and butter of organizations like this, it's so much more. It's basically any supplies that could be improved or clean, just any clean supplies to prevent the spread of disease, of STIs like HIV, Hep C, SSPs in communities, bring all these rates down, as well as creating a point of contact for people who use drugs in communities, so that when and if they're ready to make a change to seek drug treatment services or counseling, that they already have a group of people that they can trust and they can work with. And we are a free anonymous program and keep everyone's information confidential. So it's really easy for us to gain that trust, and just openly giving out materials that are relevant and responsive to this population, where they can see the immediate benefits of not sharing needles, of having chipped, of having glassware that's not chipped, or not having to worry about saving money and buying fewer materials and then reusing them. We make it a point to give enough materials that it will last until a month, so that they don't have to return again or have to worry about where they'll get clean supplies. We also offer other items and other services such as wound care, related to drug use, as well as cold weather gear and items like condoms that also help the decrease the spread of disease. But yeah, they've been handing out naloxone since 2005, and when the state really made an effort around 2018 to really increase naloxone access. That Prevention Point was a big pusher in Allegheny County in bringing overdose rates down. And at the same time, a group called Next Distro that was formed in 2017 basically operates a mail-based syringe exchange program that has affiliates throughout the country. In Pennsylvania, we're only allowed to mail out naloxone because of drug paraphernalia laws that limit what we can send. But in most other places, in places like New York and California and Michigan, where the laws are more relaxed, that they're able to send out basically a whole offering of items that you would find in any syringe exchange program, anything from naloxone to alcohol pads, condoms, clean syringes, safe smoking supplies, and information coupled with those things, and all of which we could not mail out in Pennsylvania. But yeah, this work started through the efforts of Tracy Helton, who was doing this out of her home, and the idea was adopted and scaled up through Next. And we've been collaborating with them, Prevention Point and Next, since April of 2020. And yeah, we offer a video training that's a short video in either Narcan or intramuscular, so that anybody could quickly be trained in how to administer naloxone as long as they have internet access. So cell phones are so ubiquitous now, and internet access is becoming more common, more affordable, so that basically anybody with a phone can jump on, get trained in naloxone, and just answer a few short questions on a quiz, and some enrollment questions to get naloxone shipped out to you in 2 days. And this is made possible through a standing order that the state issued in 2014 that's been updated continuously ever since. And we'll mail anywhere in Pennsylvania outside of Philadelphia, which has their own program through Next as well. This is being funded through Vital Strategies, through Bloomberg Philanthropies. And to date, we've mailed out for 6,000 doses as of today. So we've operated for a year now. And we see our numbers go up every month. We had our biggest month this past month with over 260 requests. And so we're hoping to see that continue to grow. And the folks that we're really targeting are people who use drugs, and their friends and family, and those that support them through work, with the idea being that those would be the people that could most quickly respond to an overdose. So the first groups that were receiving naloxone were like EMS and first responders, like law enforcement. But there's still a delay. Whereas if you give it directly to people who use drugs and their friends and family, that they can more quickly react and reverse an overdose. So that's been our priority of who we're trying to reach. But we're happy to give it to those who just simply want to equip themselves with naloxone. Governor Wolf has said, and other public officials have mentioned, that every Pennsylvanian should carry naloxone. So this is a means of getting that medicine quick, without any overcoming barriers like stigma, asking for naloxone in person at a pharmacy, which you're able to do through a standing order, but local attitudes have not moved as fast as public policy has. So stigma still exists. And I will also mention that Pennsylvania is a predominantly white state, and so is the overdose crisis as well. But it's not to say that it's exclusively like a white problem by any means. And so we've made special considerations and strategies around reaching Black, Indigenous, and people and communities of color, and LGBTQ plus populations as well, as historically they've been left out of a lot of like drug treatment and harm reduction efforts. And so we have kind of parallel strategies where we're addressing the state as well as these specific populations, as well as just counties that don't have any means of naloxone access, which I'll talk about here. I'll talk about in the down the road. But through this program, it's a statewide program. We're able to collect a lot of interesting data points. So specifically age, race, and gender, insurance status, and location as well. So seeing what the different needs and hearing from participants about what their experience with naloxone access is. And so we're learning more about specific areas, details about what their barriers are or what's working for them. And at the same time, all of our naloxone doses have a sticker that will have a link to our site for people to report when they've used our medicine, so they can quickly get a refill, but also share information about the overdose that either they experienced or that they were able to reverse somebody else out of. And so, so that's been interesting in seeing where overdoses are happening and hearing about what the response has been like, and about people's ability to act when it happens. But the way that we fit into the larger state, the state has a program, if you're not aware, that's done by the Pennsylvania Commission on Crime and Delinquency, that basically assigns different organizations that will act as central coordinating entities that will distribute naloxone locally to first responders like EMS and the police and firefighters, as well as organizations like community-based organizations that are connected to people who use drugs or work with them and willing to distribute it through those organizations. But unfortunately, these aren't widely advertised. The CCEs don't go out of their way to say that organizations can get it from them. So our program ends up connecting a lot of organizations who use us for training or for naloxone to this this statewide program, these CCEs. So in that way, we do some sort of snowball version of advocacy where we're advocating kind of on the fly as we're learning about organizations that maybe met resistance when they made a request to a CCE for naloxone. And then working with that CCE and the state to get it out there, because it's supposed to be a very low barrier program to the credit of the state. And so they're very flexible on what kind of organizations can distribute naloxone. You don't have to be legally organized or have an EIN number or a state ID number. And some CCEs choose to make that a little more difficult than what it has to be. So our organization works to identify those CCEs and work with the state to help organizations willing to distribute naloxone be able to access that supply and to do so. And so, as I mentioned, those become kind of springboards for like local advocacy, as well as using the data that we're collecting through the program to demonstrate the need and the efficacy of mail-based programs, and using these as emergency measures during a pandemic, as well as emergency measures during the opioid epidemic, where these overdose rates are rising, and finding quicker and expansive ways, low barrier ways to get them out there. So some targets for advocacy would be funding similar programs, funding SSPs locally. We end up meeting a lot of participants that are operating underground SSPs. And so supporting them by shipping them naloxone to encourage their continued distribution, as well as trying to connect them with their local CCEs to get them a sustainable supply, because our program really is just designed to serve individuals. So we have an incentive to get people to use this program to meet organizational and more regional needs. But we'll work with the way that Prevention Point Pittsburgh is able to operate is through a county ordinance that we advocated for in the early days of our formation. So we have the formula to share with other organizations. And so as we're meeting participants, we're helping them to organize or kind of giving them a roadmap to advocate for legislation for local ordinances so they can operate an SSP legally in their county, but also bringing them into a larger conversation that's going on right now in the state where recently a memo was proposed for legislation to legalize SSPs in Pennsylvania so that there can be above legally operating organizations like Prevention Point throughout the state and not just in Allegheny County and Philly. So Center for Popular Democracy and Evidencebased, which were consultants that came out of the Pennsylvania Harm Reduction Coalition, have been organizing stakeholders around this issue. And they seem to have taken a bit of a break as of late, but recently this memo has been released, and so the language of that bill is getting finalized, and so organizations like ours and through this mailing program are reaching out to stakeholders that we know that are interested in SSP and harm reduction services being expanded in the state, and sending them scripts and working and coaching them up on speaking with their legislatures so that when the time comes to mobilize and get behind this bill and get behind harm reduction service expansion, that we can do so and have stories and data to demonstrate the need for these services. But yeah, some of the specific laws that we and goals we'd hope to achieve: drug paraphernalia laws that would exempt syringes and create easier naloxone access, over-the-counter naloxone, taking this kind of special classification away from it so that all these hoops needed to jump through as far as getting a prescription from a doctor or limiting what could be mailed and with what information, and just making it something, the type of emergency measure and tool that it is should be as accessible as a defibrillator or a fire extinguisher, because the consequence of not having it are just as severe. And I'll also say that we have a staff member whose job specifically would be to work with those CCEs that I mentioned before that can be resistant to functioning the way that they're supposed to in this statewide program. But that's about all that I had. But hope you know a little bit. Hope you have a better idea about naloxone access in the state and where our programs fit in, and how we hope to be a proof of concept and a model for what other services can be offered around the state.
Thank you so much, Alfred, for all the information and for all the really, truly important work that you're doing surrounding harm reduction in Pennsylvania. So we do have a few questions, but we're going to hold them until the end. But if you do have questions that come up, just be sure to pop them in the Q&A feature, and we'll get to them later on in the program. So our next speaker is Erica Saylor. Erica is a research associate with the Douglas W. Pollock Center for Addiction Outreach and Research at Penn State. In her current role, Erica is responsible for assisting with the management and execution of a data-driven, statewide grant focused on reducing opioid use disorder stigma across the Commonwealth. Prior to her current role, Erica worked for the American Lung Association on various tobacco control grants that provided cessation, prevention, and advocacy services across Pennsylvania. Erica holds a master's degree in public health from Penn State University College of Medicine and a bachelor's degree in health science from Lock Haven University. Erica?
Thanks, Erica. And good morning, everybody. I'm really excited to be here and to be talking to everybody today about legislative advocacy. And giving me the opportunity to speak. So if you've been on some of the previous webinars, you probably recognize my name or face because I have a really great pleasure of working with PGP and Shatterproof to put together these webinars each month. And I'm really happy to share some of my insight and knowledge and how it can be applied to the work that you're doing in the advocacy space. So two of my biggest, just quick kind of background, two of my biggest professional passions are research and advocacy. And today I get to merge them for you, which is really exciting. So as Erica mentioned, my current role is focused on research, but I spent the better part of the last 4 years in the advocacy and public policy space, primarily with tobacco control. And today we're going to be talking about how you can succeed with your legislative visits. And really what I'm going over is some tips and tricks that you can use, and also how you can actually utilize this campaign and the data that we're collecting to be used in your visits, and really how that data can play a really great role in success of legislative advocacy. And just as a fun little note, I have included some pictures from my time in the advocacy world through here, and I'll be sharing some fun anecdotes throughout the way that are of interest. But before we get started, I would like to mention that this presentation is general and not focused on a specific OUD or SUD advocacy topic of focus. The campaign, as of right now, supports all of the great work that the community-based organizations and recovery organizations are doing with the campaign, but we don't have one that we specifically promote throughout the campaign. So at this time, but would love to hear in the question and answer session or in the chat if you have more resources that your organization does about advocacy work in the OUD or SUD space and how others could get involved. So we'll be happy to address that at the end. So today, just gonna really go over some basics. What is advocacy, some tools you can use, and really how you can utilize the tools from the campaign and infuse them into your visit. Just some basic preparation for your visit, after your visit, and really how data can increase success. And then of course, questions. Let's start off with what is advocacy. So advocacy has so many definitions if you look it up on the internet, but the really big overarching concept in all definitions is utilizing your voice. So whether that's supporting a cause, supporting another person, or educating yourself and your elected officials, it's all advocacy. And there are a lot of ways to engage in advocacy, not only through talking through your elected officials, through legislative advocacy, but also through the media and through other ways as well. So today we're primarily going to be focusing on legislative advocacy, which deals specifically with connecting with your legislative officials in the legislative branch of government. So a question I get a lot from folks is what is advocacy and how is it different from lobbying? So lobbying is really defined as influencing or attempting to influence legislative action or non-action. There's often concern from a lot of advocates about crossing the line from advocacy to lobbying, as many organizations such as higher education, not-for-profit, and others prohibit employees from lobbying, but many still allow advocacy. So if you're concerned, I would say check your HR policies or employee handbook. But on this slide here, it kind of outlines a great rule of thumb overall to kind of make sure what the work you're doing, if you are barred from lobbying, kind of stays in the advocacy realm. So advocacy becomes lobbying when all of the 4 following criteria are met. So communication with a government employee that reflects a certain point of view and specific legislation. So for example, if I meet with my representative, that's communication with the meeting, government employee, the representative, and I'm talking to them specifically about just going off of what Alfred said, kind of expanding access for syringe exchange programs. And I'm talking to them about that, educating them, that is advocacy. Now, if I'm doing all of that, and then I ask them to support a specific bill number or resolution number, that would be lobbying. So you really want to stay away, if your organization restricts that, stay away from the specific legislation part, but the education and the advocacy portion is all well and good. So when you're going in for your legislative visit, a great way to kind of enhance your work is to provide resources in this educational process that I just mentioned. So a really great way is to supplement your pitches with scientific evidence, statistics, or visuals that a legislator can keep and review after a meeting. And of course, utilizing talking points and materials to reference during the meeting, just so you can stay on track. And staying in with that same tune of utilizing data and research and statistics to enhance your visits. A really big focus over the past couple years in policy is really evidence-based policy making. So, you know, contrary to popular belief, a lot of policies aren't necessarily evidence-based, which you think is kind of counterintuitive, but it's just the way that things happen. So there's really been a lot of councils and committees that have been established to kind of enhance this mechanism of evidence-based policymaking. So why is it important? You know, evidence-based policymaking can take many forms, and that includes using research findings to inform new policies or improve effectiveness of existing policies, supporting data collection and analysis for research and management, and developing policies that incentivize the use of evidence and so on. You know, in the recent past, it's been applied to social and human services programs, but a wide variety of government programs could really benefit from building and using evidence. You know, in addition to this just being good policy to use data, statistics, and evidence to inform it, another really great thing about data is that it's a really big equalizer for visits. So data is very factual and objective. And, you know, sometimes with politics or specific policies, people have very strong feelings and might feel passionately. And data can be something that can kind of de-escalate tensions and really provide kind of this equalizing space, because it is non-subjective and it really helps enhance bipartisanship and bipartisan policy. So the great news for you guys is that, you know, Life Unites Us not only has this really wonderful, campaign with story sharing and support for all of our networks, but it's also primarily a data-driven initiative, and we collect research and we house all of that research and data, and it's actually something that is really easily accessible and there for you to use. So we're collecting data on stigma throughout the Commonwealth, and this data it's new in Pennsylvania and hasn't widely been collected in the past. And it's not only going to help, you know, the mission of Life Unites Us, but like I mentioned, it's free and easily accessible for anyone to use. So the data that's used for this campaign is actually featured on the data dashboards. There is a link to the data dashboards on the Life Unites Us website, but I will also drop one in the chat here as well after I get done with my presentation. So the data dashboards have two main features that can be really useful for supplementing legislative visits. And let me backtrack for a second and say that I know a few months ago, at the end of last year, we kind of had a webinar that teased a little bit at the creation of the data dashboards and that their availability. I am happy to say that they are complete now. They're continuously being updated, of course, as new data rolls in and things progress, but they're all complete at this point and ready for everyone's use. So the first feature that would be really useful for visits would be our survey data. So the survey itself was part of a larger study to better understand stigma associated with OUD in Pennsylvanians. And the data up there right now is the baseline survey, but as I mentioned, it's going to continuously be updated as we collect more data. But overall, we collected data about the general attitudes towards OUD, attitudes towards policy related to OUD, attitudes towards public stigma related to OUD, and attitudes towards self-stigma related to OUD as well. The next feature that would be useful for visits would be the indicators feature. And this section provides narrative background and literature with various data to help contextualize stigma. So whereas the survey section is really an exploration feature for you to explore the data, this provides a little bit more of a contextualization for you to utilize it and kind of understand the picture more fully. So what I'm going to do now is I'm actually going to take you guys and show you the dashboards just as a quick preview so you can kind of see how they operate. So bear with me here as I go through and get the proper screen shared. Right. Alrighty, so as you can see here, we have the data dashboards. The web address is here at the top, pa-dashboard.lifeunitesus.com. And it's pretty easy to use. Here's the home page here, and then the menu bar across the top. You can see home, indicators, surveys. CBOs would be our network of community-based organizations involved in the campaign. And then, of course, this is also where the webinars are housed. So we'll just start with the indicators tab. When you click on the indicators, it brings up some specific indicators that are relevant in this context. So we'll just click on the first one just to show you, which is first responders. So this section is featured on changing attitudes towards OUD and SUD among first responders. It has a lot of really great information, including an introduction, information about naloxone distribution, administration, warm handoffs, and then a really great feature here is it actually has citations and references. So if you are going through the text and you see something interesting you want to learn more about, you can check out the references, and you can also use the citation here. So a really great feature here is that, you know, if you're citing anything from this site that's ours and not from another reference, of course, you can utilize the citation there, and it's reputable and carries weight just like any other citation. So next we'll go into the survey feature, and bear with me here. It has a lot of information on it, so sometimes it takes a moment for it to load. So on this feature, you can see a summary of results or explore the data on your own. If you kind of need a little bit more contextualization or help, kind of are not as familiar with data and kind of just looking at like the basic information regarding the data, the summary of results is a really good section. But I'm going to click on the explore your own just because this is what I'm going to be referencing in a couple minutes for examples. So you can kind of pick which one you want. I'll just click on substance use. And then I'm going to pick a question here. So have you yourself ever been prescribed an opioid? We're going to explore the data associated with that just as an example briefly. So here you can see the question here is up here at the top in the dark purple. And then below it has the levels of agreement, or if they took it or didn't take it, which is really easy to read. So 50.5% of people who took the survey have been prescribed an opioid. And this survey, as I just want to mention, it is representative of Pennsylvania's population by age and sex. So you can use it confidently. What's really great about the Tableau feature here of this, you can actually change and look at different Department of Health regions by age, by gender, by county density. You can also look at race or ethnicity, political ideology, political affiliation, income, and educational attainment, and filter by all of those features if you're looking for a specific demographic. I could spend probably the remainder of the time just going through and showing you guys what stuff looks like. So I'm just going to take kind of a snapshot here, share my other screen again. Bear with me. All right, so what I did here is I just pulled a few examples that might be useful for you guys, and please feel free to go on and check out the dashboards and play with everything. There's tons of stuff, you could spend so much time. So for this one, what I did was, this could be data you pull for a legislative visit. So let's say I want to meet with a legislator to discuss drug courts and potentially criminal justice system reform. So this question here is, those who are addicted to opioids and haven't committed a felony should go into treatment and not the criminal justice system. I just filtered this by my region. I live in South Central, so I click South Central. And as you can see, almost 82% of people who responded to the survey agreed, which is a really big number. And it could definitely be used to help sway legislators and educate them that this is something that people want. The next example I pulled just briefly would be to discuss community and availability and access to naloxone, like Alfred had talked about a little bit before. So this question here said, I would be willing to purchase or obtain naloxone. And I just clicked the Southeast region just to show a different region. And as you can see here, almost 52% of people would be willing to obtain naloxone, which I think is great and a great way to further your education that people do want this and want to have naloxone and expanding, existing programs. And the final example I pulled is actually from the indicators section. So as you go through those indicators, like I mentioned, it helps contextualize the data and kind of specific examples. but it also has some interactive maps that can be useful as well. So for this one, I just pulled a screenshot of the opioid dispensations. So I clicked on the county that I live in here. It actually shows rates of opioid prescriptions over the past couple of years, and you can filter by year and quarter as well. So if you're discussing, opioid prescribing behavior, in your county or region in the past couple of years, this would be a great tool as well. So now that we kind of went through some examples that you could use, and really, like I said, I could spend all day pulling examples that might be useful, but it just depends on what your specific advocacy goals or ask is. But how can we utilize that data into our visit, or what makes sense? So what's really great about this data, like I mentioned, there is citation, so you can reasonably cite it if your organization has fact sheets or policy briefs or position statements, and incorporate it into that work and cite it. You can also give legislators the dashboard address to see it, or you can pull things for them, which I think is really interesting and interactive, and a great way to use it. You can also use it in any, utilize the maps on it, as well as, utilizing the data for social media as well. So now that you have the data pulled, you have it incorporated it into your fact sheets or policy briefs, now what? So just kind of going over some practical tips for your visit, of course. It's really important that you know every aspect of your issue, including the history. So knowing, what your organization's stance is on the issue, but also knowing potential criticism so that you can kind of counterbalance or provide solutions if the legislator brings them up. Leading with facts and data, like I mentioned, is really important, and it's hard to refute data as opposed to opinions. It's also important to know the political process, especially if you're educating at a time where there's a bill that might be of interest that's similar. Kind of where it's at, where it's headed. That's important to know as well as the media coverage of the issue and how that's being portrayed. It's also really important and useful to have kind of your key points for the visit laid out and clear and concise. And then, of course, your ask. And when I say an ask, I mean what you're asking the legislator to support specifically, to know if you have their support or not. So as you know, you're continuing to prepare. Another important thing that I always recommend people do, and people find this so funny, is to dig up all the dirt you can on the legislator. And not in a weird way, but just knowing their background with issues or issues similar to yours, how they voted in the past. The Legis website here, PA Legis website that's there, is a great resource. You can pull up how they voted on every single bill, information about them, their background, their family, really just kind of finding out what their platform is and how you can interact with that. It's really important that if you know that, let's say they have a specific interest in something, that you can tailor your messaging to kind of appeal to their likes or dislikes. Funny story with this picture here. So this was a legislative visit in Washington, D.C. If you ever have the chance to go into any of the House or Senate buildings, a lot of the members have very interesting decorations in their offices, which is interesting. This specific member had a bison head on the wall, of course, and other things, where the state that he was from, which was North Dakota. So always fun to kind of look out and see how each legislator's personality comes through in their office. Of course, in the Pennsylvania Capitol, you'll see lots of things specific to their regions as well, including sports teams or different local things that folks are known for. As you continue to prepare, I think what's really nice about legislative visits is you can, of course, go by yourself, but you can also go with your colleagues. So if you go with your colleagues, it actually helps expand the visit and make it more robust. But if you are going with colleagues, it's important to know their background, their expertise, their personal connection to the issue, and where their strengths are. If you have someone on there who's a researcher, they should focus on that component. If someone has a very convincing story and personal tie to the issue at hand, of course, let them tell their story. And moving in with that, we find it great to structure legislative visits so that you can cover everything that you need to cover. Sometimes you get really drilled into an issue or a point and it kind of takes up the time, but it's important to kind of hit everything so that you can feel confident with your work. So whether you're going with colleagues or going with yourself, this is just a suggestion for structuring. So you have the intro where you, define the scope of the problem and introduce kind of the issue at hand. You have the statistics, like you pulled off the data dashboards or other places, a few statistics, 2 or 3 that highlight, the major scope of the problem. And then the personal story. So what's the personal connection to this issue? Of course, statistics and data are vitally important for this, but your personal story is what's going to set you apart from other folks coming in to talk to them. So if you have a really great personal connection or can share or connect them with that, that's going to be a really great tool as well. And then lastly, the ask. So what are you asking them to support specifically? As you are scheduling the meeting, so I will say the pandemic has of course changed this, like it's changed everything else in life. Many legislators are using Zoom meetings right now or phone call meetings. Of course, just whatever their preference is, you just call up their office or email their office. All of their emails are online on the Legis website. Schedule the meeting. You want to arrive on time, and by on time, I mean early. The reason I say this is that their schedules are hectic, and sometimes their committee meetings or call to the floor times change, and they might only have 5 minutes. And if it's 5 minutes before your meeting and you happen to be there, that's fortuitous. Another great tip that I always found helpful, especially if you're bad at remembering names, is business cards. So if you're going into an in-person meeting and it's usually not only the legislator, but it might be some staffers and aides, is to exchange business cards at the beginning. And then put your business cards in front of you and lay them out in the order that folks are sitting at the table. So if you forget someone's name, you can just look at the business cards and refer to it, which is really helpful. You also want to take a look at the surroundings in the office. If your legislator has a bunch of football gear around for a specific sports team, you might not want to talk about the rival sports team, things like that. Or if you see something that you can connect with them on a personal level, if you're also a fan of, the sports team they support, or they have a picture of a boat, and, you're also into boating or fishing or things like that. That's always a great connection there to personalize the visit. And then of course you want to utilize your data, and, talking points is always helpful, kind of listing things out how you want to go through them, just so you can briefly look at your paper, but also still engage in a conversation. And then lastly is the ask. So some pitfalls to avoid. I know when folks schedule meetings, sometimes they're a little bit disappointed if they have to meet with legislative aides or staffers. Legislative staff do a ton of work on the back end for legislators and are so informed on everything that the member votes on, and really provide them a lot of information and resources. So if you're educating a staffer, it's just as important for educating the member, because all of that information will be relayed to them. If the meeting does have to be rescheduled or postponed, don't just leave materials there and drop them off. Just reschedule the meeting and come back. A lot of times if you just drop materials off, sometimes they get lost in the giant pile of stuff that comes in the mail or that other folks are dropping off. Another thing to kind of just be aware of is some legislators, if they're uncomfortable with an issue or they don't support the issue that you're there talking to them about, they will try to redirect the conversation, maybe pivoting about that sports team. Something really helpful is to say, like, I could talk about whatever sports team all day, but let's talk about the issue at hand. Some of them just oppose it, which is what it is. Or they won't answer. If you ask them to support, they kind of skirt around not really giving you a tentative answer or not. But I will say, if you are meeting some of these challenges, just do your best to get your message across, get your point across, and ask. And to never underestimate the power of education. In my experience, continued contact and education with legislators over time really does have the power to change people's minds. I've seen it firsthand. Another thing that's really great to have in your back pocket is an elevator speech. So this is a really quick, 1 minute speech that encompasses, the message, key story, and data, and then of course your ask. And this is something that should be short and memorable and specific and used in a pinch. So, I've caught somebody going to an elevator before and kind of gave my spiel very quickly in the 30-second ride, to the next floor. But Funny story. So this picture here was also in Washington. The woman there, her name's Christine. She was a lung cancer survivor, and I was accompanying her on visits. And we had a visit scheduled with Senator Carper, and he was called to give a vote when our meeting time was supposed to be. So, you know, there's actually a train that goes in between the House and the Senate office buildings to the Capitol for members to use to take a vote. And he was on his way to go take a vote. So we had our legislative meeting on the train underneath the Capitol for him to go take a vote. So, you know, folks say like, oh, I'm never going to need that. Trust me, if you're in the advocacy world and these folks are busy, it's always good to have one in your back pocket because you literally never know where you're going to have a visit. It's also really great, you know, after you've had the visit and you know, done your due diligence and gone through all your stuff, it's also really great to evaluate the meeting, whether it's with yourself, kind of internally, or with people that you went with. So, you know, how did the meeting go? You know, if there's some redirect or opposition, you know, what can we kind of make of that? It's also really great to follow up with a thank you. So that could be a note, it could be a personal email. If you are following up with them, remind them of the issue importance and always offer yourself as a resource. It's also really great to utilize social media. So I had a meeting one time with former Representative Tom Marino, and I got a quick picture with him and snapped him there and tagged him, which they always like on social. So I know we're coming in on time here, but this is the last slide, I promise. So quick anecdote on how data increases success. So in 2019 was a rough year for tobacco control funding. I won't get into all of the ins and outs, but the Appropriations Committee in the House was leading a charge to not fund programming because they were saying it wasn't effective. Even though year after year we had an advocate network that met with them and showed them, you know, all of the benefits, you know, constituent engagement, all of this stuff. But they kept saying it was ineffective, show us that it's working. So thankfully, we used all the data that we had collected over years of enrollment, of services, of cost effectiveness, how the money was being used, everything that we could simply pull. And we launched a major attack through in-person visits, phone calls, emails, and targeted the Appropriations Committee with all this email from their constituents all across the Commonwealth. And just before the budget was going to be released, I had a meeting with the chair of the Appropriations Committee, and I walked in there that morning ready to, you know, do battle and say my piece, and he was like, "You did it. You did it. We're going to fund it because we've had so many people calling in here that have showed us that this is cost effective, that it's worth it." So with all of that being said, data can really enhance these visits and really make a difference. So with that being said, I will turn it back over to Erica.
Thanks, Erica. Thank you so much for all that information and for your insight into advocacy. I know we had a couple of comments on the slides just asking if they'd be available because a lot of people believe that they will be very useful. And yes, they will be available on our website with the webinars. So you'll be able to find them there. So I want to thank both of our presenters for all their expertise and for their presentations. And now we're going to move into the question portion of our session. So we'll begin to go down through the questions in the order that they were asked. So, so I see that there was a question for Alfred. Are you getting many responses completing the survey if a dose is used from community members?
Sure. I would say that we've gotten, out of the 1,600 requests that we've gotten, we've received 67 reports back about overdoses. So they're few and far between, but oftentimes it's a lot of good qualitative data about like the response time of first responders if they were called, or how many doses were needed to revive somebody. So it's good on the ground information from people who use drugs, but it's honestly not that much. It's kind of like bonus information the way that we treat it, but few and far between, unfortunately.
Okay, and can you, there was also another question for you. Do you know, can New York, Michigan, and California send kits to other states?
Yes, the short answer is yes. There is an amount of legal risk that the recipient would assume by making that request, but I will include a link in the chat. I misfired earlier. I sent it, but I'll put it in again. That goes into more detail about how to go about making a request for more supplies if you live outside of those 3 states. But yes, you can receive it.
Okay, great, thanks.
Just quickly, I'd like to thank everybody for their questions. And also, you know, if anybody is engaging in advocacy work and would like to share that with the campaign or to get more people involved in your effort, you know, please feel free to email us or drop information in the chat. You know, we would love to be able to connect, you know, folks who are interested in doing advocacy work with, you know, already established, you know, recovery organizations or community organizations that are doing that work.
Thanks. Okay, so we're coming up on the hour. So I do want to thank everyone for their attendance and participation in today's webinar. And as a friendly reminder, after you leave the webinar today, you will be automatically redirected to a survey. Please just, if you could, take a few minutes to complete the survey to let us know what we did well or could improve on, and just your thoughts in general. Thanks to everybody, and take care, and we'll see you next time.